The first item on the agenda is approval of the agenda. The chair will entertain a motion. Thank you, Commissioner Snell, Commissioner Williams. Any questions on the agenda? Hearing none, all those in favor will please say aye. Aye. Any opposed? Thank you. Now we're up to public comment. Public comment is 3 minutes per person. And we're not going to enter into a discussion, but glad to hear comments by the public. Public comment is now open. Public comment is now open.
Oh, that's me? Oh, sorry. I was looking for my name on here.
Public comment is now open.
Hi, everybody. My name is Barb Freisinger, and I'm here today searching for an appointment to the Health and Human Services Board. I have been a part of the health and the behavioral health side of the services in Jackson since 1982. And have gotten to work with a number of boards and agencies since then. So I want to bring all my years of experience, relationships, and any types of skills that I have to the board. Do you have any questions?
We'll take up your appointment later on in the agenda.
Okay.
But thanks for introducing yourself, Barb. Appreciate it very much.
Okay, bye-bye.
Additional public comment. Hearing no additional public comment, public comment is now closed. We'll move on now to committee items. First up is minutes from last month's meeting. The chair will entertain a motion to approve. Thank you, Commissioner Snell, support by Commissioner Bear. Any questions? All those in favor will please say aye. Aye. Any opposed? Thank you. And now we move to appointments. This month's appointment is an appointment to fill the DHHS board with a public member for a term expiring in October of 2028. Current member is Kenneth Price, and our applicant is Barbara Freisinger. Chair will entertain a motion to nominate applicants for the DHHS board. Commissioner Snell nominates Commissioner Barbara Freisinger. Are there additional nominations? All those in favor of recommending Barbara Freisinger to the full board will please say aye. Aye. Any opposed? Thank you. You are nominated, Barb. What will happen is at next week's full commission meeting is when we will make the formal final appointment. Okay? And now, Lifeway's quarterly report. CEO-elect Cassie Watson is here. Welcome.
Good afternoon. My name is Cassandra Watson. I am currently the Executive Director of Clinical Services at Lifeways. Mary Beth unfortunately couldn't be here today. She had to be at Hillsdale County Board of County Commissioners meeting this morning and just couldn't make it back in time. So I'll be presenting on the November 2025 report for Jackson County. As Earl mentioned, Lifeways has a new CEO select, so I have the awkward responsibility to introduce myself to you. Mary Beth wanted to be here to do that, but the Lifeways Board of Directors did select me as the next CEO, contingent upon a successful background check and a completion of the contract. So a little bit about me. I've been employed with Lifeways since 2016, so I'm approaching my 10-year anniversary. I started in quality improvement at Lifeways and then worked my way up to executive leadership for clinical services. I have a master's degree in public health from Michigan State University, so go green. A master's of science in nursing from Eastern Michigan University. You sense the green and white theme. I'm a licensed advanced practice registered nurse in the state of Michigan, and I hold a national board certification as an adult geriatric primary care nurse practitioner. But most importantly, I'm a wife and I'm a mother of 3 kids, ages 7 months to 5 years. So that is a very busy life. The next thing on the report that Mary Beth submitted to you is that we are undergoing our 3-year accreditation process for the Commission on Accreditation of Rehabilitation Facilities. It's a requirement of MDHHS and of the Michigan Mental Health Code that we be accredited. So we do use CARF as our accrediting body, and we are seeking several accreditations. You see that in your report. There's a substantial list, some of which are new, some of which we've already been accredited for. And we really hope to achieve the 3-year accreditation status. The next really exciting thing that's happening at Lifeways is the partnership with Jackson County's Sheriff's Office. And this partnership is for the SAFE program, and it's a really exciting opportunity that Monroe County has already implemented. But essentially, it allows for people with special needs, so diabetes, autism, and other conditions that can change their response to stressful situations or what their behavior might look like in a time of crisis, so that they can sign up and be put on a log or a list that when a emergency notification goes out, the sheriff's office or the EMS providers are notified that they're on this list, that their behaviors might look a little different than someone without some of those conditions. And this list also comes with the ability to get stickers like these that they can put in their windows, so law enforcement, EMS approaching a door can see those and know that that's occurring. And this was really promoted by Sheriff Schutte. So he may have talked about this at some meetings. And Lifeways is really just a supportive partner. Our goal is to support the sheriff and be a satellite site for individuals and then for the emergency personnel. You'll also see at some point, it's in production right now, a flyer with more information. But if you have questions or want more information for your constituents, you can reach out to the sheriff, or you can reach out to our Executive Director of Access and Crisis Services, David Lowe, for more information. But we're really excited because this is this ongoing collaborative partnership that we have with the Sheriff's Department that has awarded the community so many opportunities and really enforces that community policing approach, which is a best practice. I think I presented on this last time, the Healthcare Angel Award, but last time we didn't have the article included in the report. So just note that LaShonda Walker, who's a recipient rights specialist at Lifeways, was selected for the Healthcare Angel Award, and we're very proud of her. And the link to her article is actually included in this report, so you can click right on it to read more about LaShonda. Lifeways Crisis Intervention Team continues to provide trainings. We had 10 officers attend last week, including some from Washtenaw County. So it's an additional expansion of a partnership to provide crisis intervention training to law enforcement, not only within our own communities where the focus is, but also in external communities. So we're really excited about that partnership, and we're very proud of the local law enforcement agencies who are participating, as well as our own crisis teams. MDHHS has their finalized fiscal year 26 budget, and I want to just remind you of how we're funded. So the state receives Medicaid funding and then provides that to a PIHP. It's a regional entity that then provides funding to the local CMHSPs like Lifeways. And so that funding trickles down from the federal to state, regional to Lifeways. So just as a level setting on how we receive funding. There's no significant changes to the total budget for Medicaid behavioral health services, but you might notice some line item changes. So Medicaid line item looks like it has a reduction, and that's not really what occurred. What occurred is they actually reappropriated funding to CCBHCs, which is a certified community behavioral health clinic like Lifeways, because the state of Michigan, instead of following that funding structure that I just mentioned, they are now directly paying CCBHCs instead of having the PIHP regional entities then work with the CMHSPs and the CCBHCs. So essentially just that line item represents that direct payment structure versus going through the typical structure that we're used to. The other item that we'll just note is that general funding at the state level has not changed since 2014, and that's important when we think about, and it's included in the report later, The federal changes that are coming, if there's a reduction in Medicaid services or there's the healthcare premiums, if those go up and less people have access to insurance, we might see more people walking through our door who are not covered, which would impact our general fund, which is used for priority populations like pregnant women. And so why that's important is that the general funding has not changed, it has not increased, it has not decreased. And so when we think about availability of resources, we might see that that is much more impacted by some of the changes that are coming than what we've experienced previously. That's also why the millages are so important and why we continue to utilize millage services, because the communities support the services that we're providing, and those might be critical in the coming years. I think last time I presented on the PIHP procurement. So again, the PIHPs are what fund the CMHSPs. That's how we receive our funding for Medicaid services. There is a procurement going on where the state of Michigan will competitively select PIHPs. There is also, at the same time, litigation against the state of Michigan for that. So there's two sections in your report. I'm just going to kind of combine my comments here. Bids were due on October 13th of 2025, and Lifeway's PIHP, which is Midstate Health Network, did submit a bid. They acknowledge it's a non-conforming bid. It's unlikely that Midstate will be selected, although there is a chance that they'll be selected. In the midst of this, there's several CMHSPs, Lifeways is not one of them, and PIHPs that have submitted lawsuits against MDHHS. And in your report, you'll see that Judge Yates of the Court of Claims did identify that, yes, MDHHS can select regional entities. Yes, they can competitively procure. But what remains in question is whether they are violating Michigan Mental Health Code by taking away what's called managed care delegated functions from the CMHSPs. And those functions are utilization management. That's the ability for CMHSPs to contract with their local providers in their communities. So the mental health code is very clear that CMHSPs have to be able to maintain those relationships within their communities and also have a say over the utilization and authorization of services within their communities, because each community is unique. So what is to be determined as of December 8th is whether or not the Court of Claims will actually issue a full ruling on that matter. The hope that the Court of Claims had, we believe, is that MDHHS would take a look at the RFP and adjust some of the language around the managed care functions and Office of Recipient Rights, and they did not do that. They've indicated they still plan to proceed with selecting bids by, I think it's December 13th or mid-December. So that is going to result in us having to, or the complainants going to back to the court. So really in a holding pattern on that one. And then you'll see in your report the federal One Big Beautiful Act bill. The only thing that I'll point out here, the information that's included is just as an FYI, because these questions come up frequently, but Michigan Public Behavioral Health System is funded on a capitation model, which means that the way that we are funded is based on the number of Medicaid eligible individuals in our catchment areas. So for Lifeways, that's Jackson and Hillsdale County. What happens if there are less people that are eligible is that there is less funding that comes to our direct counties. Now, the state has the ability right now to determine how they're going to approach that funding reduction. They may say we'll increase rates for services, which would then offset some of those changes because of the reduction in Medicaid eligible beneficiaries. We just don't know. So again, we're in a holding pattern of waiting to see how is the state going to respond. What we're doing internally is really planning for how do we really tighten up our services? Are there opportunities for us to reduce costs? And really just assessing what's our plan moving forward once we have a little bit more clarity on what we can do, what's feasible and what's not. But truly, it's at the state right now that we have to figure out what the state will be doing before we can make solidify plans. And that concludes my report. Are there any questions?
Questions for Lifeways? Hearing none. Chair will entertain a motion to receive the report. Thank you, Commissioner Bear and Commissioner Williams. All those in favor will please say aye. Aye. Any opposed? Thank you. Madam CEO-elect. And next up is the medical care facility. Destiny is here.
Good afternoon. Okay, so for today's report, I do have financials for August and September to share with you. There should also be a PowerPoint that was attached.
We can just move to the September one, right?
We didn't touch on August, but yes, we can move to the September one.
Okay.
So September revenue was $279,976 better than budget. Part of that had to do with the receipt of certified public expenditure money that we received. If you recall, from 2 months ago, I did report that some of that money was taken back to repay the overpayment from Medicaid that had happened in prior years. And then the rest of that was booked here in September's financials. For expenses, we were $117,935 over budget. This can be attributed to both health insurance cost and some additional overtime in wages for the nursing department during the month of September. Our net position, we were $102,041 better than budget. Census was 2.83 bed days better than budget with 38 admissions and 35 discharges. So that puts us at year to date with revenue $50,114 behind budget, expenses $995,973 over budget, with a change in net position of $1,046,087 less than budget. Now, just as a reminder with that, in October, our new Medicaid rate started. And that Medicaid rate, we anticipate to see about $500,000 in additional revenue in the rest of this fiscal year. So that starts with October's financials. So hopefully we'll see that reflected there for us. Census overall, we're sitting 1.07 bed days behind budget, with a total of 438 admissions and 430 discharges. You can see our census trend line to date in the following slide, with the pink and the orange indicating where the budgeted census was.
Destiny, remind us that full capacity is 191, is that right?
194.
194.
Yes. So we have seen that a couple times this year, and then we, with the Medicare churn that happens with short-term residents, we'll see a large influx in census, and then those people go home because they've received their rehab, and that's where you see these dips. So over time, we've been working on making those dips last less time over time. So as you can see, those times seem to be shortening for the most part. So there are some practices that have been put in place there to handle that. And then in our additional financial narrative, our AR days out are 47 days, which is below our goal of 54 days. We are estimating 37 days cash on hand, and that does not include the amount still earmarked for repayment for Medicaid, which is 1.17 million, which we're expecting won't be due until after our next Medicaid audit. So we're anticipating sometime next year for the rest of that repayment to be due. At this time, we don't anticipate any additional MOE usage other than what we're going to request through the resolution that Cecilia will be presenting after I complete my report today. Is there any questions about my report?
Questions for the medical care facility, please? Commissioner Bear, please. Thank you.
Good afternoon. It always seems that these reports are rather rather dismal, the losses. What's it going to take to turn this around, get this out of the red and get this into the black? What is needed?
So I think where things get a little complicated is these are operational losses. So there are outside actuarial things that impact what the total bottom line looks like from year to year. So when we have our audit, for instance, what I present to you each year, you continue to see what looks like losses. But when we have our audit and all of the non-operational side of things play into that, we're actually in a good financial position where we're breaking even or doing a little bit better each year. But that's not what you see presented in these meetings. So I do understand your concern. The other piece that I think is important to note is we went into this year knowing that we were going to run a deficit. We were trying to do the best that we could to minimize that deficit. But part of running a deficit also impacts our Medicaid rate going forward. So because most of our reimbursement comes from Medicaid, and Medicaid pays about 85 cents on the dollar for the care that we provide, it's important that we maintain the current cost of care in order to be able to increase our reimbursement rates to continue to provide care long term. So it's a very different model than what you see in the rest of the business world. So to answer your question, the increase in our Medicaid rate that we received October 1st is substantial. We're talking about $2 million in additional revenue that we're expecting for next year. So that's going to make a big difference in how the budget is set out going forward into the next year. Some of the areas for expenses that have been an issue this year, we're looking at very closely. Health insurance has been a big factor for us. We have a self-funded insurance plan, which is different than a fully funded insurance plan in that we pay the health care claims as they come up. Over the last several years, that plan has been a cost savings to the facility. However, this year, it felt like we kept running up against that month over month in the budget. So we're looking at that as what is our option for next year? Do we continue with the self-funded option, or do we move back to a fully funded option in order to kind of even out the cost to the facility? So those are a couple of the key areas that we're looking at. And I know that's not a super specific answer to your question, but hopefully that helps.
That helps. Time frame, when do you expect to, with these changes that you've just mentioned, what time frame do you think they'll start showing up in your budget numbers?
So the revenue itself, that's going to change. We're going to start to see that additional revenue starting in the month of October. But as far as how that's going to look for the overall financial impact to the facility, we probably won't see that for at least a year.
Okay, thank you.
Yes, thank you.
Mr. Overton has a question.
Destiny, is there a way to present the information or numbers? And I would throw Cecilia in on this as well, because you say, the numbers you present to us paint, we'll say, a less than positive light, and the audit turns that around. Is there a way to change what we present, or that it reflects more positively?
Well, the biggest change that we see when we get our audit and we do our audit is the adjustment for OPEB expense and pension expense, which we can't accrue throughout the year appropriately because we're waiting for those actuarial numbers. So I think that keeping in mind what the audit information shows at the end of the year is important as we're looking at this from a pattern perspective. But I don't know that there's a better way to present that, but I am certainly open to suggestions.
Well, it occurs to me that if we look back at the history of what our adjustments are every year, we can project what we anticipate them to be. It's not a ironclad, but you can project. And if you project, it would put you in a much better light and perhaps provide a more accurate reflection of what we believe it will be at the year end. Now, obviously, an audit is an audit. It has to wait for that to be finalized, but we'd have a projection, and therefore that might resolve some concerns, folks have about seeing the numbers.
And I will certainly talk that over with our folks doing our accounting and make sure that that aligns for them, so. Okay, thank you.
Further questions? Chair will entertain a motion to receive the report. Thank you, Mr. Willis and Commissioner Williams. All in favor will please say aye. Aye. Any opposed? Thank you.
Thank you so much.
And now Cecilia, I think, is presenting the resolution with respect to the medical care facility draw on the MOE.
Good morning. Oh, no, it's afternoon now. This is my third one. So yes, it's afternoon. We've made it. Okay, so the Jackson County Medical Care Facility and their board did approve a resolution where they do this every year, and they're requesting monies to come from their MOE to pay their interest payment, the November interest payment. So this resolution is just the board concurring and agreeing that would be fine for us to transfer the MOE funds to pay that interest.
Questions on this issue? Commissioner Bear, please.
One question.
Okay.
I understand where these monies are coming from, and they're paid, and they need to be paid. My only question is, if this November interest payment was due November 1,
Yep.
why is it coming to us November 10?
Well, we went ahead and paid the payment. It's just, I did not receive the resolution in time in order for me to do this in October. So it's already been paid. It's just now we're going to replace those funds.
It's already paid,
Yes. It wasn't late.
so then we don't need to do anything.
No, you do. You still need to approve this resolution because I still need money. I still need to transfer monies to cover the payment. So
You want us to authorize backdating the check, okay?
I'm not backdating a check. It was paid on time.
Any further questions? Commissioner Bear, I would welcome your motion to adopt the staff resolution. Thank you. And Commissioner Snell supports. Any further questions with respect to the MOE payment? All those in favor will please say aye. Aye. Any opposed? Thank you.
All right. Thank you.
Cecilia.
Yep.
And now the Department on Aging. I see Danielle here too. Good to see you, Danielle.
Good afternoon, everybody. Just a few highlights for this month. We did receive the WellWise contract award for it just covers the month of October. We started our new grant year, goes from October through September. I did want to note that we did receive an advancement on the federal funds. This went before the board of WellWise, and they did approve the advancement, so we did not have to wait for federal funds for the month of October. So we're very appreciative that the board was willing to go ahead and do that. As we're waiting to get the federal stuff finalized. If they need to make any adjustments on those funds, they'll do that when the full award comes out, and hopefully there's not any major changes. I don't expect that. I think that the funding will kind of remain very level. I did want to highlight that we're doing what they call a community conversation piece with the state of Michigan. And this is looking at older adult services as the state is planning their 2026 of how that's going to roll out, things that they want to make as priorities. I think one of the benefits for our area is that it's going to align the regional plan along with the state plan. So it is something, if you guys are available on November 17th, that you could attend an in-person facilitation around that discussion. We learned last week there is a survey that I could forward to Administrator Overton. So if you're unable to attend that meeting, you can offer your input via survey. That survey is due by December 15th. On November 19th, we have Dawn Foods, coming in to support the Department on Aging through a couple different activities. They're going to be packing emergency meals and painting bowls for our Soups On for Seniors event. It's a great opportunity for the department to highlight all the great work that we're doing around nutrition. I think that's their big focus, is on the nutrition for the populations that they serve. And so we have the North American leadership team. That's pretty exciting to have been picked to a place that they can volunteer and give back in the community. I created a chart just about referrals by source, and I tried to compare this to 2023 as the last time I presented this to the board. And this kind of gives you an indication of where we receive referrals for Meals on Wheels, for home care, for the various services that we provide. The biggest change when I looked back onto the 2023 and compared it to the 2025 is that we saw a drop in the area of medical. This would be from like hospitals, home health care agencies. And so we went from like a 16% down to like a 4% on the number of referrals that were coming in that source. But where we picked up was actually on the self-referral. So I think what we're seeing is that we're seeing more people reaching out and making those choices for themselves if they're looking for resources. So we went from, originally it was a 45% up to a 58%. So that was kind of that big swing that we saw on that. And again, I think that that's very, it gives us a chance to say, you know, if we were to go out and do some presentations or to try to direct reach out to target different things, we could definitely reach out more to the medical field, but we are receiving the referrals from individuals in the community that are looking for services themselves. So I think that's a good thing. One of the things I wanted to highlight was just a client comment around the area of one of our drumming classes. This is a volunteer-led exercise class. Originally, it just started out being like 3 Fridays a month. It was something that occurred to like in an afternoon period around 2 o'clock. Recently, it has increased to include Tuesdays around 9 o'clock, I believe that time is, also volunteer-led. So they've seen an increase of people wanting to participate in that activity to expand it. So we're very thankful for the volunteers that helped to lead that. But I think the overall impact of the programs that we do is kind of the reflection of the seniors' comment. And what I'll read kind of what she had informed us. She said, I told the group after we finished a cardio drumming class that I was so happy to be here with them and that before the class, I just wasn't feeling it. I was low energy, kind of down, you know, stuff. And after class, I just felt so good, energized, and happy to be with everyone, which is really kind of the focus, again, of the services that we provide, bringing people together, forming those natural friendships, and just being uplifting to the individuals in our community. And that's all I had to report.
Questions for the Department on Aging? John, come on, Commissioner Wallace, I beg your pardon.
Yes, is there a hip hop drumming into that cardio class?
I'm sure they play all kinds of music.
Thank you. That's all I have, Mr. Chair. Thank you.
Thank you. Chair will entertain a motion to receive the report. Thank you, Commissioner Snell, Commissioner Williams. All in favor will please say aye. Aye. Any opposed? Thank you. Thank you,
Right,
Danielle.
thank you.
And now our Health Department, Madam Director.
Good afternoon. As per usual, I have my monthly report for you all. One of the things I just want to point out before I start going through numbers is I've been working with my team to try to figure out, you know, how to really capture in this report the difference that we make in the community. One of the things about public health is if we're doing our job and we're doing it well, you should know that we're happening. Your water should be safe. Your restaurants should be safe. You know, our community, our communicable diseases should be under control and being done and monitored as they should. So it's one of the things, especially coming out of, we just had our state annual conference for Michigan Premier Public Health, and it's one of the things that we talk about a lot is how do we showcase, you know, some of the things we're doing when you know 60 some employees at the health department are working every day, and it's hard to see we're not, we're not in the hospital, we're not healing someone. So we've been talking as a team to try to how to make that impact and not just show you numbers every month. The numbers are important, the numbers are there, but I have my my group and my team of supervisors and coordinators of different programming trying to really look at that and try, to explain a little bit more about what some of those numbers mean, not just that we served X number of maternal infant health, infants and moms, but what that meant to those. So, quick reaction to that. One of my maternal infant health staff was able to summarize some of their satisfaction. We do satisfaction in different kind of surveys as required, some by our program and grant requirements, but also some of the things that we do, on our own quality improvement initiatives. So just recently, they did a maternal infant health survey and showed that participants in the program do feel respected, supported, and informed about their child's development. This is one of our, just as a reminder, one of our home visiting programs where either a nurse or a social worker goes out into the home of a either pregnant or mom with a new baby to help with some social supports and things like that for them. So they can could give you a much better synopsis of what that actually looks like when they're in the home. But these are, families in need and moms and babies who need different supports. So being able to, be there for them and out in the community is, I was actually thinking too back on last month when I was here and we were talking about some of those numbers, and it's hard to, if we make an impact on one child, what the ripple effect of that could be. So we're going to try to point out some of those things a little bit more, try to seek those opportunities to show you those things a little bit more. Again, this one just kind of happened upon my desk as it came in today, but I'll try to highlight those things as we go on. Health education, our Empowering Youth Today, and our teen pregnancy prevention programs are in the schools, working, doing the things that they do on a regular basis. Our school wellness program, kindergarten oral health, and hearing and vision programs, again, all in the school, doing all of the screenings and everything necessary for those. I think I was able to report when I was here, some of our I don't remember when the date was at the last meeting, if the state budget had passed yet or not, but we were, anticipating and hoping that everything would come out positively on our end in that budget, and it did. So we retained our funding at the level that it had been and in the same capacity that it had been. There was some concern that it was going to go into the schools and go to the schools directly and then have to trickle through us for like hearing and vision, but that did not happen. So we are able to operate as we have for many, many years. Our community outreach information is on there. I do want to spend a little bit of time talking about opioid response and our opioid funding. September 30th marked the end of the first year of the RFP, the proposal and the grant funding that we awarded to community, or that you awarded to the community that we monitored, starting would have been October 1st of 2024. That ended that first year, and so we've just begun our second year with Home of New Vision. So there's some things that they've highlighted as positives through year one. This was a new opportunity for us, so a growing opportunity to learn, how to work with them and how to manage through that grant process. But we've done it, and we're starting year two, and then I'll give you a little bit more information on where we go forward from there. But just to remind you of what was approved and what the Home of New Vision and that funding went to, it was to primarily support their engagement center and to support the staffing for 23 staff members that are at their engagement center there. One of the areas that we do as well that was a growing concern for them was for communicable disease screening and referrals to other resources to get help and assistance that are needed. Overdose prevention, we continue to, not only does the health department on our health education side, but our support of the Home of New Vision continues to keep Narcan in the community. Everyone should have it. It should be around. You just never know, whether it's grandma with forgetting that she took something or, someone else that you see somewhere that needs it. The Home of New Vision is really working on their care coordination. They've worked with the Care Hub Jackson Care Hub, which is a closed-loop referral service, so that people with needs can get the resources and care that they need. The other part of that I just want to mention, so I mentioned we're starting our second year. We did a 2-year grant cycle for that first round of funding. When we did that, we followed the Health Department's fiscal year RFP process, when actually that's a county. It follows the actual funding for that, follows the county's calendar year fiscal year. So we are putting our second, you may have seen in a press release that came out a couple weeks ago about the next round, so round 2 of the RFP. We have approximately $300 cash on hand available that we can give out to the community again. So we opened another RFP. I'll be bringing you next month for your recommendation what responses we get after we do some initial evaluation to make sure it meets the prevention requirements of that funding, and then we'll bring that to you next month. So those proposals are due, I think, next Monday, the 17th. So that went out, and we'll be starting our round 2. So we'll actually have a little bit of an overlap, but we want to get that money out into the community while we have it. So any questions on that before I move to the next?
Commissioner Willis has a question.
Yes, I did have one question. I see in the EYT and the opioid program, I see some JPS schools there. I don't see any in the TPPI or the TOP programs. Is that just something are they covered in those programs as well?
We had some staff turnover. I don't know where we were last year, if we were in there last year. We did have some staff turnover, so that a new staff person had to get in and start the programming there this year. So I wouldn't be surprised. We've always been in JPS schools with both of those programs. So I can't tell you exactly why we're not there this semester, but I wouldn't be surprised to see us not be there in the next curriculum cycle, in the next either, I don't know if it's trimesters or how they actually get into
You
the
wouldn't be
schools, but
surprised to see that we are or
that
we're
we
not?
are, that we go get back in there, especially as that top program, as I mentioned last time, is a curriculum that we have to follow to fidelity. So our staff member had to be trained and then get set up with the schools and learn all of those relationships of getting into the schools and stuff.
Okay.
So
Thank you. Thank you, Mr. Chair.
Yeah. At some point, will you make mention of the federal budget issues effects upon your department? What things you've had to do to adapt?
Well, we've already hopefully been hit with the most of the worst of our funding reductions. As was mentioned in Lifeway's report and medical care facility report, Medicaid reimbursement rates will always be something that because we do have Medicaid reimbursable services, so that will potentially, depending on where we come with some of those looking out through the year, have an impact. Most of our funding right now is pretty secure. We don't, because the state is a primary pass-through, our WIC program, if there were any major cuts to those, we would feel that. But at this time right now, we're feeling pretty confident in where we stand with the federal avenues that we have right now continuing. If you remember, we took a big hit back in March and April of this year with big funding reductions right after the new administration came in and had started eliminating some things with some of the ongoing COVID funding and things like that were supporting some of our programming that we were able to disseminate and distribute across different ways. So,
Commissioner Bear has a question.
Thank you. Looking at your opioid settlement community award, after 1 year, the Home of New Vision highlights. I presume when we get more of these opioid monies, that we can put them out to bid again.
it's out
as
right
we
now.
have. Can you kind of give me a report card on Home of New Visions? Are they doing everything you had wanted them to?
Yes, that and probably more. It was, remember, this is all new, so it's hard to put a lot of measurables in place that where we want people to be. So this does allow them, and we support 23 of their staff members. So without that, I can't make a direct correlation that without our funding, they wouldn't have those 23. Our funding doesn't support 23 staff members, but it does allow them to supplant some of their use for other needs, and they can focus on, as you remember, your request was that this was that the opioid funding followed the state Attorney General's guidance and followed the prevention aspect of that. So there's a list of all of the Attorney General's uses, and we have the prevention aspect. So allowing them to focus on that prevention allows them to do other services in the community that we don't support or aren't supported elsewhere, so.
Thank you for that update.
I can definitely, though, as we go on especially, and we'll be able to see, hopefully from year 1 to year 2 with Home of New Vision and this grant, I don't know where, this is a 2-year project, so I don't know if they will reapply or if, you will choose to, it'll all depend on what we receive in this second round of funding that's due next week and where that priority lies. So it's hard
Okay,
to
that
measure some of
helps.
that
Thank you.
because it's a kind of a starting point, so.
Okay, thank you. We may have interrupted your flow if you've got more
Nope,
to.
that's okay.
Okay.
Now I'm going to switch to personal and preventative health. Just talk about a few things on there. I snatched a couple graphs out of our clinical services area to talk about some of the things. So when you talk about funding and you ask about funding, some of our, like our sexual health clinic in here, one of the things that was noted and one of the things that they talk about in task and keep track of that doesn't usually hit my plate because I see it as a bottom line, but is our sexual health, the fee service, the fees that we collect for those. Some of our services are not either billable or reimbursable by Medicaid or any of the other health insurances that we do coordinate with. So every year when we come to you with our fee schedule, our sexual health clinic fees are one of those things that you approve every year. And we still support it without the ability to pay, but knowing that we've made our fees enough that 75% are willing to or are able to pay for those services when they come in for it. So then the other 25 is coming out of our grants and our bottom line. So that was one of the things that I found, pretty, like I said, I see the kind of the bottom line of those budgets. I'm not looking at the day-to-day who's paying for their services or who's not because I'm not in the clinic every day. A couple other things, just kind of where we're at in the community when I post all of those bullet points of all of the different locations and places where we are in the community. A lot of those are health fairs and things like that, but a lot of them are on a regular basis just within our community programs. Our clinical staff is out doing immunizations in the community, doing sexual health testing in the community, doing those kind of things out there. And so you'll see the number of vaccines we gave out in the community and testing that we've done. Some of that testing would also fall into the Home of New Vision. That's one of the areas that we've focused on and found a high success rate is being out and with their mobile clinic and doing some of that testing right out there with them. So a little bit to point out about WIC. WIC is SNAP funded. So that is one that has been of a lot of discussion back and forth when you talk about federal funding. We know that's going to continue. It's just, is it going to affect any of our individuals at the moment? One of the big questions we have is if SNAP funding is decreased across the board for regular food assistance, will our WIC program numbers, I've reported to you for a while now that our WIC program numbers have been declining, but we may see as SNAP is reduced that more people are seeking out assistance from the Women, Infants, and Children program. So more to come on that. We'll keep watching those numbers. Our staffing and our funding hasn't been reduced over the last couple of years, even though our numbers have dwindled a little. So we've kind of been watching that to see, where that goes. And I'm actually, like I said, curious if we'll start to see an uptrend in that. Communicable disease. Respiratory virus season is here. We're reporting low numbers right now. There's a emergency and urgent care visit that we keep track of. Those are relatively low right now, but the next time I'm here, it'll be December. We have snow on the ground today, so more of that inside. spending all our time indoors increases and ramps up that that respiratory virus season. What we have seen a lot of, and we've seen it's been across the state, and even outside of the state, but locally here in Jackson, is hand, foot, and mouth disease. So one of the things I talked about last month in here was, how we reach the school. And so that's, an area that when we know these things are going around, then we can target our outreach efforts to the parents and schools about, what to do and when something like that happens,
What does that
whatever it
look
is.
like? What does that look like? Hand, foot, and mouth?
It's a rash and a fever, I believe. They get rashes on their hand. It's red, hand and feet. If I could read without my glasses, I could, I could focus a little bit more on that. If you can zoom it in, that should give you really all of the instructions or all of the indicators of it.
Chair Shotwell has a comment.
You raise a question in the back of my mind, and this is overall health department question. Do we still keep an immunization record for each child enrolled in the schools, or is that no longer in our bailiwick?
It is not in our bailiwick anymore. It is the state on MICR, Michigan Immunization. No, nope. We put information and we put and pull information from MICR. And so anyone who receives an immunization within the health department realm, their immunization gets put in there. And and then we monitor that for when we're looking at immunization waiver rates and or individuals who are in the schools and haven't either gotten a waiver or been adequately immunized. That's where we're pulling all of that information. But no, one of our things that we do though with that is try to assist and ensure that the offices are correctly putting that information in. So if they need assistance with that, but we don't go there and pull that. No. It's all done through the My Chart and their stuff. And
Well, I had some vaccinations last week at Walgreens, and
yep,
they put
use
it
the
in.
same.
They put it in something, and she gave me a printout of where my vaccinations stood. So that does seem to be the way it's going. Yes, Mr. Chair, that's how it'll go when I next get my rabies vaccination. Sorry to interrupt with levity. Go ahead.
And then our environmental health, our water and our, food and our, all of the fun things, environmental health, continue onward. We are really looking at, revamping our software is happening. We are meeting weekly or biweekly with them. We're getting everything on our end in place so they can start making that transition. It'll be a big transition from a lot of paper into hopefully a really usable system from not only our staff end, but also the community being able to look in and see what they need as well.
And it appeared to me that Eagle is finally turning up the heat on the Spring Arbor mobile home park out there, Arbor Village. That's just an ugly situation out there.
Yes.
Further
all I
questions for
have.
the Health Department? Chair will entertain a motion to receive the report. Thank you, Commissioner Snell and Commissioner Williams. All in favor will please say aye. Aye. Any opposed? Thank you. We now move to claims. Commissioner Bear, are the claims down that way? Okay, that's where they are then. Commissioner Williams will go find them upstairs. All in favor of paying the claims will please say aye. Aye. Anybody opposed? Thank you. I don't know that I actually had a motion there. Sorry, Madam. Okay. Snell and Williams will make it. Yes. Normally, I'm pretty good about that. Just missed it this time. Please take note of other minutes, not other minutes there, but next month's reporting, Department on Aging, Health Department, DHHS, and the Medical Examiner. We're now back to public comment. Now, a 2-minute per person public comment. Is there public comment? Last call for public comment. Hearing none, public comment is now closed. Any committee member comments? Hearing none, we stand adjourned to the call of the chair. Thank you.